All right, sports med students, we are going to go over some anatomy of the shoulder. We've been talking about this for a while. I wanted to make this video for you guys to familiarize yourself with this particular model ahead of your practical exam. So let's go ahead and get started. Hopefully this is a good review tool for you guys. As you guys can see here in this model, we are looking at an individual's right shoulder. We can tell this because the clavicle is up in the front, the anterior side, as well as the coracoid process is on the anterior side. So if you are looking at this individual, this is you looking at them, this is their right shoulder. Okay, so let's go over bones first. That kind of sets our landscape up, sets the scene for us. So like we mentioned, this bone right here, this nice little S shape right in front, this is the clavicle. On this side here, the medial side, it's going to articulate with the sternum or the breastbone. So if we had the sternum here, it would be medial right here, attaching right here at the medial end of the clavicle. So clavicle. This bone here, this is the upper arm bone or the humerus. The ball or the head of the humerus is here, and then this is the shaft of the humerus. This bone right here, this big triangular or wing looking bone, is your scapula. So we've got the clavicle or the collarbone. This is the humerus or the upper arm bone, and this is the scapula or the shoulder blade. Okay, we do know that we have some bony prominences to be aware of, particularly on the scapula. So here anteriorly, this bony prominence protruding out is the coracoid process. This one here is the acromion. In our video, the man who narrates that video, he says that this is the roof of the shoulder. If we turn our model around, looking at it from a posterior side, kind of reorient yourselves. This is still a right shoulder. We're just looking at them from the back side or the posterior side. We've still got clavicle, we've still got scapula, we've still got humerus. Okay, this nice ridge here is the spine of the scapula, and if you follow the spine of the scapula, it is what becomes the acromion process. So I'll take the video up so we can look at it from a superior view. If we follow the spine of the scapula, it becomes the acromion process right here, that roof of the shoulder, and then you can still see the clavicle here and the humerus down here. Okay, so one of the things that is nice about this spine of the scapula is it does help us orient ourselves to some other things on the scapula. So if we have the spine right here, if we go superior to the spine, this is the supraspinous fossa. Superior. So superior to the spine is the supraspinous fossa. If we go inferior to the spine, this is the infraspinous fossa. Supra, infra, superior, inferior. So if you guys break those words down, you can infer, and you would be correct, that the supraspinatus muscle sits here and the infraspinatus muscle sits here. If we flip it back over to the anterior view, this is the anterior side of the scapula. So this is the subscapular fossa. So you can infer that the subscapularis sits here. Okay, so again, like we talked about in class, if you know the bones, if you know the bony landmarks, it's much easier to know your ligaments, your joints, your muscles. So make sure that you guys are aware of those things. Everything else is a whole lot easier if you know the bones and the bony prominences. Okay, so let's take a look at the joints next. So we've got several joints that make up the shoulder joint. The true shoulder joint, or the one that you think about when someone says, okay, I dislocated my shoulder, okay, my shoulder joint is hurting. The one that they're most likely talking about is the GH joint, the glenohumeral joint. So if you guys look right in here, where the humeral head articulates with the glenoid fossa or the glenoid cavity of the scapula, that creates the glenohumeral joint, the GH joint. Okay. Another joint that we have is the articulation between the clavicle and the acromion. So So if you break that down, we got clavicle and acromion. That creates the acromioclavicular joint. The acromioclavicular joint. We also have another joint that's not really a joint. These don't actually touch each other or connect, but in some textbooks you will see this referred to as a joint. We've got the coracoid and the acromion. The coracoid and the acromion. So you would refer to this as the coracoacromial joint. Coracoacromial joint. Okay. Same thing here, very similar. We have the articulation between the coracoid process and the clavicle. Again, not actually touching, but they are connected by ligaments. So you'll refer to this as the coracoclavicular joint. Coracoid, clavicular, coracoclavicular joint. Okay. Another articulation to be aware of that it's really difficult to see on this model, and therefore I won't be asking you about this joint on the practical using this model, would be the articulation between the subscapular fossa or the scapula and the rib cage. So where the scapula glides against those ribs as you move your shoulder is the scapulothoracic joint. And again, that's a false joint. There's no ligamentous connection, there's no muscular connection. There's just the space where the scapula glides on the rib cage. That's the scapulothoracic joint. Let's flip this guy around here one more time. We are now going to talk about the ligaments and the muscles. So let's go with ligaments first. So like I said before, if you know the bones, if you know the bony prominences, the joints become super easy and the ligaments become even easier. The joints and the ligaments almost always have the same name, especially when it comes to the shoulder. So let's start with this one up top. So let's take it from a superior angle again. We said that the acromion articulates with the clavicle at the AC joint, the acromioclavicular joint. So guess what this ligament is called? The acromioclavicular ligament. Remember, this is a super weak joint. It's commonly injured. It only has this one ligament. It's super superficial, not a whole lot of soft tissue to protect or cover it. So the AC joint is really weak, commonly injured. Acromioclavicular ligament at the acromioclavicular joint. Okay, let's flip this bad boy over. We're back to the anterior view, and we have some more ligaments to consider. We have the coracoid and the clavicle, coracoclavicular joint. So this ligament is the coracoclavicular ligament. Okay, then we have these two ligaments here. It's like a little V shape. In my class, you only need to know this as the coracoclavicular ligaments. If you go on to pursue any sort of medical degree, you are going to realize that these are in fact two separate ligaments that have two separate names, the trapezoid and the conoid ligament. But for the purposes of this class, you will know this as the coracoclavicular ligaments as a group. Okay. We also have another group of ligaments that are not found on this particular model, but you do need to be aware of them. It's a big, thick band of ligaments. We have an anterior band, a posterior band, we have a superior band, a big group of ligaments that kind of encapsulates this whole shoulder joint and connects the humeral head to the glenoid fossa, and those are your GH ligaments. Okay, you have your glenohumeral ligaments, superior, middle, and inferior bands, anterior and posterior bands. Again, not labeled on this model. They are kind of taken off so that we can see the rotator cuff and other ligamentous structures, but you do need to be aware that there's a thick band of tissue that connects the humeral head to the glenoid cavity, and that is referred to as the GH ligaments. Okay, so those are the ligaments that you need to be aware of. Before we talk about the rotator cuff, I want to address the one other dynamic stabilizer that we have. So dynamic stabilizers are contractile, and in this case, this is a muscle that is creating dynamic stability in the shoulder. The ligaments are static stabilizers, okay, but this particular one is a dynamic stabilizer. So this right here, get my hand out of the way, this little skinny band of tissue is the long head of the biceps tendon. the long head tendon of the biceps. Okay. We also have a short head, but it is not considered to be a dynamic stabilizer of the shoulder. So I need you guys to be aware of this long head. See how it comes superiorly over the head of the humerus, and it will actually insert on the superior aspect of the glenoid and superior aspect of the labrum to act as a dynamic stabilizer and depressor of the GH joint and humeral head. Okay, so that is a dynamic stabilizer of the shoulder. So moving on to the rotator cuff. These are also dynamic stabilizers of the shoulder. There are 4 of them. You can remember them by the acronym SITS, S-I-T-S, standing for supraspinatus, infraspinatus, subscapularis, and teres minor. As you can see, I went out of order. I apologize. Let me repeat that for you. Supraspinatus, S, infraspinatus, I, T, teres minor, and the other S is subscapularis. So let's flip this bad boy around and go in order. So we talked about the spine of the scapula, supraspinous fossa, which means that this is where the supraspinatus sits. So if we look superiorly, the supraspinatus is right here. It's going to kind of follow underneath this tunnel. You can see it right through there. And then if we come over here to a lateral view, it's going to come underneath the acromion, and it's this guy right here. So number 33 is actually the supraspinatus tendon. Okay. We're going to go back here again. We know that this is the infraspinous fossa. So this is where the infraspinatus sits. So this right here, number 31, this is the infraspinatus tendon. We know that nestled just underneath the infraspinatus is a smaller muscle called the teres minor. So this is the teres minor tendon right here. Okay, so we have the supraspinatus, infraspinatus, teres minor, and then the only rotator cuff on the anterior side of the shoulder is going to be this one, the subscapularis. This is the subscapular fossa. So this is the subscapularis tendon. Okay, so that is the anatomy on that's the anatomy shown on this model. I hope that is helpful. Please let me know if you have any questions or concerns. I would be happy to help you.